Yes, good morning to all. In last class, I have discussed about the adrenergic receptors and mechanism of action of adrenergic receptors and classification of adrenergic drugs. Okay, so in today's class, I'm going to explain about the pharmacological actions of adrenergic drugs. Okay, here mainly I will differentiate the pharmacological actions of adrenaline, noradrenaline, and isoprenaline. Okay, so here the first thing is what that is adrenaline. Okay, so this adrenaline, it is binds with all adrenergic receptors, that is alpha 1, alpha 2, beta 1, beta 2. Okay, but adrenaline having less beta 3 action. Because of adrenaline, it is less sensitive to beta 3 receptors. Okay, next noradrenaline, it is binds with alpha 1 receptors, alpha 2 receptors, beta 1 and beta 3 receptors. Because of noradrenaline, it is sensitive to alpha 1 receptors, alpha 2 receptors, beta 1 and beta 3 receptors. Okay, but noradrenaline does not have any action on the beta 2 receptors. Because of noradrenaline, it does not bind with beta 2 receptors. Okay, and next one is isoprenaline. Okay, so this isoprenaline drug, it is binds with beta 1, beta 2 and beta 3 receptors. Okay, but isoprenaline does not have any alpha actions. Okay, because of isoprenaline, it does not binds with alpha receptors. Okay, and isoprenaline is only binds with what beta receptors. The types of beta receptors is beta 1, beta 2 and beta 3 receptors. Okay, so no, here noradrenaline, it does not binds with the beta 2 receptors. There is no effect of noradrenaline on beta 2 receptors. But here adrenaline having less effect on beta 3 receptors. Okay, but in isoprenaline, there is no alpha actions. Okay, because of this isoprenaline drug, it is only sensitive to beta receptors. Okay, and next one is adrenaline. Okay, so here the action of adrenaline, it is a receptor mediated. Okay, so this adrenaline, it produces the two kinds of effect, either excitatory effect or inhibitory effects. Okay, so in case the excitatory effects, it will be occurs due to stimulation of alpha receptors. Okay, excitatory effects is occurs due to what kind of receptors? That is alpha receptors, except in intestine, because of in this adrenaline, if it is binds with alpha receptors, means what will happen? The contraction effect, it will be produced in smooth muscles. Because of alpha 1 it is acted through GQ coupled receptors, and alpha 2 receptors, it is what kind of receptors? That is GI coupled receptors. Okay, so here the overall effect of alpha receptors on smooth muscle is what? Contraction effect. Okay, but except in the intestine. So why? Because what will happen in that intestine region? Because in intestine consists of alpha receptors, both alpha 1 and alpha 2 receptors. Here the alpha 2 receptors are mainly hyperpolarizes the cholinergic neuron. Okay, what hyperpolarizes the cholinergic neuron means what? Because of it is as a result of hyperpolarization of cholinergic neurons, means what will happen? There is a decrease in the release of acetylcholine. Okay, then what will happen? The acetylcholine decreases means what? What is the action of acetylcholine on intestine? Is contraction. Okay, but here as a result of stimulation of alpha receptors in intestinal region, especially alpha 2 receptors, then what will happen? Now there is a hyperpolarization is occurs at the cholinergic neuron. Means there is a efflux of potassium ions in the cholinergic neuron. That is called as hyperpolarization of cholinergic neuron. Then as a result of hyperpolarization of cholinergic neurons, there is no release of acetylcholine from that there is no release of acetylcholine from that cholinergic neuron. Then what will happen? There is no effect of acetylcholine on the intestine. Okay, actually what is the effect of acetylcholine on the intestine is contraction effect. Okay, but as a result of stimulation of alpha receptors in intestinal region, what will happen? The contraction effect, it will be reduced. Okay, if it is acted through alpha 2 receptors, means in case of alpha 1 receptors, means what will happen? Alpha 1 receptors are directly hyperpolarizes the smooth muscles. Okay, alpha 1 receptors are directly hyperpolarizes the smooth muscles. Then what will happen? As a result of hyperpolarization, then what will happen? There is no contraction effect. Okay, because of there is a efflux of what ion? Potassium ions. Okay, so the potassium ions is lost in the intracellular region. Okay, so as a result of efflux of this potassium ions, then what will happen? There is a relaxation effect is occurs in the intestinal region. Okay, so adrenaline, it produces the both kind of effects, excitatory effect and inhibitory effect. Okay, so this excitatory effects is occurs due to stimulation of alpha receptors. Okay, except in the intestine, because of in intestinal region there is a inhibitory effect is occurs. Okay, due to hyperpolarization. Okay, due to hyperpolarization of cholinergic neuron. Okay, or hyperpolarization of the direct smooth muscles. So as a result of hyperpolarization, there is a relaxation effect. It will be occurs in the intestinal region. Okay, and this adrenaline, if it is binds with the beta receptors, means there is a what will happen? The inhibitory effect it will be produced. Okay, because of what is the action of what is the action of beta 2 receptors on smooth muscles is what? Relaxant effect. Okay, in last class I have discussed what is the mechanism of action of beta 2 receptors on the smooth muscles. Okay, that is the relaxant effect it will be produced. Okay, so except on the heart, because of that heart consists of what receptors? Beta 1 receptors especially. Okay, so the heart consists of mainly beta 1 receptors. Then what will happen? So there is a increase in the cyclic AMP formation in the heart, in cardiac cells, because of the beta 1 receptors are GS coupled receptors. Then the cyclic AMP formation is increased in the heart muscles. Then what will happen? The cyclic AMP formation is increased in the heart region, means there is a contraction effect it will be produced. Okay, so here the remaining the beta action on smooth muscles is what? Relaxant effect. Because of the cyclic AMP, the excess levels of the cyclic AMP in smooth muscle is causes the relaxant effect. Okay, the same cyclic AMP effect on heart is what? Contraction effect. Okay, so that's why, so adrenaline, it produces a both excitatory effect and inhibitory effect. Okay, if it is alpha receptor stimulation is occurs, means excitatory effect is occurs, except in the intestinal region. Okay, the inhibitory effects is produced due to stimulation of beta receptors, except in the heart. In heart region, there is a excitatory effects it will be produced. Okay, and what? So overall effect of adrenergic drugs on the heart. Okay, so here the heart consists of mainly beta 1 receptors. Okay, and it is a most powerful cardiac stimulant drug, adrenaline. Okay, and they consist of positive chronotropic effect and positive inotropic effect. Means what? So that adrenergic drugs are increases the heart rate and increases the force of contraction also. Okay, and one more thing is there. So the beta receptors, it is mainly present in myocardium, okay, cardiac cells. Okay, so as a result of activation of beta 1 receptors, so then what will happen? The beta 1 receptor is associated with GS protein, no? GS protein, okay, stimulatory guanine nucleotide binding protein, that is known as GS. Okay, so then what will happen? The pacemaker, it will be activated. Okay, as a result of activation of GS protein, the pacemaker, it will be activated. Okay, so there is a stimulation of pacemaker activity. Okay, so what is a natural pacemaker in our heart? That is SA node, that is sinoatrial node. Okay, so a sinoatrial node, it is a natural pacemaker. Okay, so this SA node, it generates the action potential, and this action potential, it will be propagated to atria wall, and then it will be propagated to atrioventricular node, then it will be propagated to what? Purkinje fibers, bundle of his, and it is reaches to what? Ventricles also. Okay, so the overall effect of adrenergic drugs on the beta 1 receptors is what? Stimulant effect. Okay, increases the heart rate, increases the force of contraction, and increases the pacemaker activity, and increases the conduction velocity also. Okay, and in case of the heart rate is increases by increase in the slow diastolic depolarization of cells in the sinoatrial node cells. Okay, so heart rate is increases by increase in the diastolic depolarization of cells, the cells which are present in sinoatrial node. Okay, and at the high doses of these adrenergic drugs, there is a increases the heart rate and increases the BP. Okay, because of it causing the reflex depression or depression at the what? Sinoatrial node. Okay, so reflex depression of SA node. Okay, so as a result of depression of SA node, there is a stimulation of latent pacemaker cells in the AV node. Okay, so what is mean by latent pacemaker cells? Okay, so this latent pacemaker cells means these are the one kind of cells. Okay, so this cells is especially present in electrical conduction system. Okay, and these cells are mainly present in below the sinoatrial node. Okay, so here at higher doses of these adrenergic drugs, there is an increase in heart rate and increases the BP. And finally, there is a depression of sinoatrial node is also occurs. Okay, then what will happen? There is an activation, there is an unmasking of latent pacemaker cells. Okay, so these cells are mainly present in below the SA node. Okay, and then this latent pacemaker cells is activated in the AV node and Purkinje fibers also. Okay, and in case that local anesthetics example, halothane and chloroform. Okay, local anesthetics drugs example, halothane and chloroform. So these drugs are sensitize the what? Heart. Okay, these drugs are sensitize the heart, and what will happen? After sensitization, there is a increases the arrhythmic activity of adrenaline. Okay, both halothane and chloroform, both drugs are causes the sensitization of heart. As a result of sensitization, there is a increases the arrhythmic activity of adrenaline. Okay, and what the cardiac systole, it is becomes very short and it is more powerful. And finally, the cardiac output is also increases and oxygen consumption is also increases. Okay, and the cardiac efficiency is become reduced. Okay, and the conduction velocity at the AV node is also increases, and atrial muscle fibers is also increases, and the conduction velocity at the ventricular fibers is also increases, and bundle of his also increases. Okay, because of the pacemaker activities increase in the response to activation of GS coupled receptor. Okay, the GS receptors means the stimulatory G protein coupled receptors. So because of beta 1 receptors is associated with the GS coupled receptors. Okay, so that's why there is an activation of pacemaker cells. Okay, then the conduction velocity is increases. There is a more propagation of impulses from electrical impulses mainly. Okay, there is a more propagation of electrical impulses from SNO to atria wall and SNO to AV node to bundle of his to Purkinje fibers. Okay, and these adrenergic drugs are mainly used for the treatment of what partial atrioventricular block. Okay, and this drug is reduces the refractory period in all cardiac cells. It reduces the refractory period in all cardiac cells. So what do you mean by refractory period? Okay, refractory period means it is a period. So during this period, the muscle is incapable of responding to stimulation. Okay, so that period is called as refractory period. Okay, so here the adrenergic drugs are reduces the refractory period because of what this beta adrenergic drug beta sorry, these adrenergic drugs are active with the pacemaker cells. Okay, the activity of that pacemaker cell is increases, then there is a more production of the electrical impulses. That electrical impulses, if they will be propagated from the SA node to AV node to bundle of His to Purkinje fibers. Okay, so the conduction velocities increases at the mainly AV node or ventricular fibers or Purkinje fibers or bundle of His. So that's why it is used for the treatment of AV block. Okay, and the refractory period is also reduced. Means what? It's a period. In this period, there is a muscle is incapable of producing the incapable of responding to what stimulation. Okay, and effect on blood vessels. Okay, so what is the adrenergic drug effect on blood vessels? Okay, so vascular smooth muscles consist of alpha receptors and beta receptors. Okay, so here the vasoconstrictionist effect is occurs in case the adrenergic drugs are binds with alpha receptors, means then what will happen? Vasoconstriction effect it will be occurs because of the alpha 1 and alpha 2 receptor mechanism of action on vascular smooth muscle is what? Constriction effect, contraction effect. Okay, so here mainly the vascular smooth muscles consist of beta 2 receptors mainly. Okay, mainly beta 2 receptors is present at the smooth muscles and vascular smooth muscles. So here what is the mechanism of action of beta 2 receptors on smooth muscle? That is relaxant effect. Okay, so that is called as vasodilation. Why relaxant effect is occurs? Because of there is a more production of cyclic AMP in the smooth muscles. Okay, so in that cases, in the smooth muscle, the cyclic AMP formation is increases, means the cyclic AMP is decreases the myosin light chain kinase. Okay, so the cyclic AMP levels is increase in smooth muscles, means what will happen? The myosin light chain kinase enzyme, it will be inhibited. So myosin light chain kinase enzyme is inhibited, means what will happen? There is a phosphorylation of muscle protein. It will be decreases. That muscle protein is known as what? Myosin. Okay, so the contraction effect, it will be automatically reduced. Okay, so that's why the beta 2 receptor mechanism of action on smooth muscle is what? Relaxant effect. Okay, that is called as vasodilation. Okay, but beta 1 receptors mechanism of action in heart is what? Contraction effect. But beta 2 receptor mechanism of action on smooth muscle is what? Relaxant effect. Okay, So depending upon the drug and depending upon the receptor binding. Okay, and there is a decrease in the blood flow to the skin region and decrease in the blood flow to the mucous membrane region and renal region also, because of the alpha 1 effect and alpha 2 effect. Okay, so what is alpha 1 and alpha 2 effect? That is vasoconstriction effect. So what is the action of alpha receptors on vascular smooth muscle? That is contraction effect. So as a result of vasoconstriction, there is a decrease in the blood flow to the skin region and decrease in the blood flow to the mucous membrane region. Okay, and there is a increases the blood flow to the skeletal muscles. Okay, and increases the blood flow to the coronary vessels and increase the blood flow to the liver vessels. Why? Because of beta 2 effect, mainly because of what will happen in that cases. Sorry, so these beta 2 receptors are mainly present at the skeleton muscles and skeleton muscle blood vessel. Okay, and the vessels which are present in skeletal muscles, and the beta 2 receptors are is mainly present in coronary vessels and liver vessels. Then what will happen? What is the mechanism of action of beta 2 receptors on smooth muscle? That is dilation effect. Okay, so as a result of vasodilation, dilation effect is nothing but relaxant effect. Okay, so as a result of vasodilation, there is an increases of blood flow to the skeletal muscles and coronary vessels and liver vessels, because of that adrenergic drugs, if it is binds with the beta 2 receptors, means there is a vasodilation is occurs at the skeletal muscle blood vessels and coronary vessels and liver vessels. Okay, and next one is effect on blood pressure. Okay, so depending upon the catecholamines involved. Okay, so the blood pressure effect is depends upon the type of catecholamines involved. Okay, depending upon the involvement of that catecholamines. So for example, noradrenaline. Okay, so this noradrenaline, it is increases the systolic blood pressure, diastolic blood pressure. So finally, the mean BP is also increases. Why? Why? Because noradrenaline, it does not binds with the beta 2 receptors. Okay, means what? There is no noradrenaline effect on peripheral organs. Okay, so the noradrenaline effect on heart is what? Contraction effect. The systolic blood pressure is increases and the diastolic blood pressure is increases. Finally the mean BP is also increases. But because of the noradrenaline does not binds with the beta 2 receptors. Okay, means there is no noradrenaline effect on smooth muscles. Either it is vascular smooth muscles or in visceral smooth muscles. Okay, because of noradrenaline, it does not binds with the beta 2 receptors. Okay, so here noradrenaline, it is binds with mainly beta 1 receptors. Okay, and beta 3 receptors, but less there is no binds with beta 2 receptors. Okay, so that's why the noradrenaline effect on BP is what? The BP is increases because of systolic blood pressure is increases, diastolic blood pressure is also increases. Okay, contraction effect it will be produced mainly. And isoprenaline, it is increases the systolic blood pressure. Okay, but decreases the diastolic blood pressure. Why? Finally the mean BP is also reduced. Okay, why? Because if isoprenaline, if it is binds with the beta 1 receptors, means what will happen? There is a cardiac stimulation is happens. Okay, so the beta 1 cardiac stimulation is happens. So as a result of beta 1 cardiac stimulation, there is a systolic blood pressure is increases. Okay, the systolic blood pressure is increases due to beta 1 action. And this isoprenaline is decreases the diastolic blood pressure due to beta 2 effect. So what is the effect of beta 2 receptors on blood vessel is what? Dilation effect. Vasodilation means the relaxant effect it will be produced. So that's why the the diastolic blood pressure it will be decreases. Okay. So finally the mean BP is also decreases. Okay. So that isoprenaline it is causes the what increases the systolic blood pressure and decreases the diastolic pressure due to activation of beta 1 and beta 2 receptors. So the final BP is also reduced. And in case of slow injection, the slow injection of adrenaline, okay, in case of the slow injection of adrenaline, then what will happen? The systolic BP is increases and the diastolic BP is decreases. Okay, the mean BP is increases. So why? Because what is the reason? In case of slow IV injection or slow subcutaneous injection, in that cases, the peripheral resistance, it will be decreases. What do you mean by peripheral resistance? Peripheral resistance means the resistance of the arteries. Okay, the resistance of arteries to blood flow. Okay, so the resistance, it will be increases when the arteries are constricted. Okay, and this resistance, it will be decreases when the arteries are dilated. Okay, so in vasoconstriction region, the resistance is increases. In vasodilation cases, the peripheral resistance, it will be decreases. Okay, so here the slow IV injection or slow subcutaneous injection, in that cases, the peripheral resistance, it will be decreases. Means what? The vasodilation effect, it will be produced. Okay, the peripheral resistance is decreases means what? Vasodilation is occurs. Why? Because if the arteries are constricted means the resistance is increases. If the arteries are dilated means the resistance, it will be decreases. Because if the arteries are dilated means what will happen? The blood, it will be easily flow in that blood vessels. Okay, so that's why the resistance, it will be decreases. Okay, so then what? Why the peripheral resistance is decreases? Because of this beta receptors are more sensitive to adrenaline. Beta receptors are more sensitive to adrenaline than alpha receptors. So that's why even though in slow injection, nothing but in low doses of the drug, in by the what in IV or in subcutaneous injection of this drug, okay, then what will happen? The peripheral resistance is decreases. Means what? The vasodilation effect, it will be produced. Why vasodilation is occurs? Due to the beta receptors are more sensitive to adrenaline than the alpha receptors. Okay, means what? What is the beta receptor action on blood vessel? Beta receptor action on blood vessel is what? Dilation effect. Okay, and what next one? In case the rapid IV injection of adrenaline. Okay, the rapid injection of adrenaline, it is increases the both the systolic BP and diastolic BP. Okay, in case of the slow IV injection, here peripheral resistance is decreases. Okay, here the peripheral resistance, it will be increases, and the rapid IV injection of this adrenaline, it is increases the both the systolic and diastolic BP. Because in large concentration, okay, in that large concentration, the alpha actions are predominant. Okay, even though in skeletal muscles, actually the skeletal muscles consist of mainly beta receptors. Okay, but in higher concentration of these adrenergic drugs, what will happen? Vasoconstriction is happen even though in skeletal muscles, because of this alpha actions are predominant in the skeletal muscle, but BP is returns to normal within a few minutes. Okay, so this is the differences between noradrenaline, isoprenaline, and adrenaline. Okay, so isoprenaline, it is decreases the mean BP, and noradrenaline, it is increases the mean BP. Okay, and isoprenaline is finally decreases the mean BP, but noradrenaline and adrenaline, it is increases the mean BP. Okay, so but in case of slow IV injection means what will happen? The mean BP somewhat less increases compared to rapid IV injection. Compared to rapid IV injection, the mean BP is less increases. Okay, means the mean BP is increases, but not more than rapid IV injection of adrenaline. Okay, and what is the summary of this adrenaline, noradrenaline, and isoprenaline? Okay, so adrenaline, it is increase the heart rate. Okay, but not noradrenaline not increases the heart rate, but isoprenaline, it is increases the heart rate. Why isoprenaline is increases the heart rate? Because of isoprenaline drug, it is more sensitive to beta receptors, and isoprenaline drug, it is more sensitive to heart region also. Because of isoprenaline is more sensitive to what? Beta receptors. Okay, so especially beta 1 and beta 2 receptors is also present in heart region. So that's why the isoprenaline, it is increases the heart rate. Okay, the double arrow is there, means isoprenaline is increases the heart rate. Okay, it is more increases the heart rate and compared to adrenaline. Okay, and the cardiac output is also increases. Adrenaline is also increase the cardiac output, and isoprenaline is also increases the cardiac output. Okay, and why isoprenaline is increase the heart rate and cardiac output? Because of isoprenaline drug is more sensitive to beta receptors, and it is more sensitive to heart. Okay, heart organ. Okay, and the systolic BP is also adrenaline is increases the systolic BP, and noradrenaline is also increases systolic BP. So the finally isoprenaline is also increases systolic BP, and diastolic BP, adrenaline, it is increases. So in case of slow infusion of adrenaline, it may decreases the diastolic blood pressure. In case of rapid IV injection, it is increases the diastolic blood pressure. And noradrenaline, it is increases the diastolic blood pressure. And finally, the isoprenaline, it is also decreases the diastolic blood pressure due to beta 2 receptor activity. Due to beta 2 receptor activity, what? See this isoprenaline, it is decreases the mean BP due to stimulation of beta 1 receptors and beta 2 receptors. So what is a beta 2 receptor action on blood vessel? Is vasodilation. Okay, so here isoprenaline is decreases the diastolic blood pressure. Okay, find what is the adrenaline? It is increase the mean BP. Noradrenaline is also increase the mean BP. Finally, the noradrenaline, it is increase the mean BP. Okay, compared to adrenaline. Okay, and isoprenaline is decreases the mean BP. Okay. Blood flow to the skin and mucous membrane is decreased by adrenaline, and it is also decreased by noradrenaline. Okay, and there is no isoprenaline effect on blood flow. In kidneys also, in kidneys, the action on the kidney is also decreases. Adrenaline, it is less effect on kidney. Okay, and it is also less blood, means the blood flow to the kidney is also decreased by adrenaline and noradrenaline. Okay, and the blood flow to the liver is also increased by adrenaline, and isoprenaline is also increases the blood flow to the liver. Okay, and coronary vessels also, blood flow to the coronary region is also increased by adrenaline and noradrenaline, isoprenaline. Both are same effect. Adrenaline, noradrenaline, isoprenaline. That increases the blood flow to the coronary region. Okay. And what is the action of action on the respiratory system? Okay, so the adrenaline action on respiratory system. So action on the respiratory system, first thing is a powerful bronchodilator. So why it is powerful bronchodilator? Because of it relaxes the what? Smooth muscles. Okay, bronchial smooth muscles. But noradrenaline, it does not relaxes the bronchial smooth muscles. Because of noradrenaline, it does not binds with the beta 2 receptors. Okay, because of beta 2 receptors are mainly present in the smooth muscles. Okay, so here noradrenaline, it does not binds with the beta 2 receptors. Okay, so that's why there is no noradrenaline effect on bronchial smooth muscles. Okay, so the remaining adrenaline and isoprenaline both are, it will shows the effect on smooth muscles. Okay, what is that effect? That is relaxant effect. Okay, because of this is a beta 2 mediated effect. Because of what is a beta 2 receptor mechanism of action on smooth muscles? That is what relaxant effect. Because of the cyclic AMP formation, it will be increase in smooth muscles. So cyclic AMP formation is increased means what? MLCK enzyme is function is inhibited and muscle protein function is also inhibited. Okay, so that's why the dilation effect it will be produced. And these adrenergic drugs are inhibit the bronchoconstriction, especially histamine-induced bronchoconstriction. It is inhibited by adrenergic drugs. Okay, so here adrenaline, it is act as a physiological antagonist to mediators of bronchoconstriction. Example, histamine. Means what? This adrenaline drug is inhibit the histamine-induced bronchoconstriction. Okay, and next action on GIT. Adrenergic drugs act on GIT. So it relaxes the gut muscles. Okay, both alpha and beta. Okay, first I will explain about beta. So what the smooth muscles consist of? What receptors? Beta receptor. Beta 2 receptors is also present in vascular and visceral smooth muscles. Okay, so what is the effect of beta 2 receptor and vascular smooth muscles? That is relaxant effect. Okay, then what about alpha actions on gut region? If alpha 2 receptor is activated, means there is a hyperpolarization of cholinergic nerve. Okay, so as a result of hyperpolarization of cholinergic nerve, means what will happen? There is a decrease in the release of acetylcholine from the cholinergic nerve. Means what? What is the activity of cholinergic neurotransmitter and the intestine region? That is contraction. Means the acetylcholine action on intestine is what? Contraction effect. But here, as a result of hyperpolarization of that cholinergic neuron, there is a decrease in the release of what? Acetylcholine from that cholinergic neuron. So that what will happen? The contraction effect, it will be reduced. Okay, then if in case of alpha 1 agonist, so this alpha 1 agonist is directly hyperpolarizes the intestinal smooth muscles. Okay, then the contraction effect, it will be reduced. Hyperpolarization is nothing but there is a efflux of potassium ions. Okay, from that muscle cells. Means what? There is a potassium, there is a contraction effect, it will be reduced. Okay, so the this adrenaline drug effect on gut muscle is relaxant effect. It is acted through both alpha receptors and beta receptors. But that sphincters, it will be constricted. Okay, pyloric sphincter, lower esophageal sphincter, upper esophageal sphincters, it will be constricted. And here the peristalsis movements is also reduced. Okay, so that overall effect of adrenaline on GIT is it not a important in clinically. These effects are not important. Okay, but the final effect of adrenergic drugs and GAT is relaxant effect. Next, bladder effect on bladder. There is a relaxed detrus muscles. Okay, so the detrus muscles which are present in urinary bladder. So that detrus muscles consist of beta receptors, mainly beta 2 receptors. Means what will happen? Beta 2 receptors on smooth muscle is relaxant effect. Okay, but it constricts the what? Trigone. Okay, then what will happen? Both actions which will be having both actions are oppose the voiding of bladder. Okay, what do you mean by voiding? Voiding means urinary incontinence. Okay, so as a result of these two functions, relaxation of this detrus muscles and the contraction of this trigone, means what will happen as a result of this physiological function? There is a oppose the voiding of block the voiding activity of bladder. Means what? Anti-voiding effect it will be occurs. Means the urinary incontinence effect it will be reduced. Okay, and effect on uterus. Okay, so adrenaline it contracts and it relaxes the uterus. Okay, both adrenaline it contracts and relaxes the uterus because of alpha action and beta action. So what is the alpha 1 and alpha 2 action? Smooth muscle contraction effect. Okay, what is the beta action on smooth muscle is, sorry, alpha action on smooth muscle is contraction effect. Beta action on smooth muscle is laxant effect. So adrenaline it contracts the uterus due to alpha receptor stimulation. Adrenaline it relaxes the uterus due to activation of beta receptors. Okay, but the net effect depends upon the status of the uterus and depending upon the species also. In case in pregnant women, the uterus it will be relaxed. In non-pregnant women, there is uterus it will be contract. Okay, the final effect on uterus. Okay, and this adrenergic drugs effects on vas difference. Okay, so that is contraction effect due to alpha receptors. And this adrenergic drugs on seminal vesicle is also contraction effect. Okay, due to stimulation of alpha receptors. Okay, and action on skeletal muscles. Okay, skeletal muscle action, what? Adrenaline effect on skeletal muscles, it is increases the neuromuscular transmission. Okay, neuromuscular transmission is increases. Okay, as a result of adrenaline act on skeletal muscles. Why? Because of it stimulate the release of acetylcholine. Okay, adrenaline it is stimulate the release of acetylcholine at the neuromuscular junction due to activation of alpha 1 receptors. Due to activation of alpha 1 receptors in that presynaptic nerve terminals, there is stimulate the release of acetylcholine from that nerve terminals. Okay, then what will happen? As a result of release of this acetylcholine neurotransmitter, there is a enhancing the muscle spindle firing. Means there is a continuous release of nerve, continuous releasing of what? Impulses from that muscle. Okay, so then what will happen? There is a finally tremors it will be happen. Tremors means shaking movement. So the shaking movement is occurs due to muscle spindle firing. Means the continuous occurrence of impulses from that muscle spindle. Okay, the continuous impulses generation is occurs due to what? Due to release of acetylcholine, due to increases the neuromuscular transmission. The neuromuscular transmission is increases due to increase in the release of acetylcholine because of activation of alpha 1 receptors on the nerve terminals. Okay, and the final outcome of the final effect of adrenaline and skeletal muscle is what? Tremors. Okay, due to increases the neuromuscular transmission. Okay, then the muscle spindle firing is also increases. Okay, as a result of muscle spending firing, there is a tremors, it will be happens. And effect on CNS. What is the effect on CNS? There is no visible clinical effect in normal doses. Okay, because of it is poor penetrate to brain region, adrenaline, and the some less effects it will be occurs. That is restlessness, tremors, and apprehension. Okay, and activation of alpha 2 receptors in CNS, it decreases the sympathetic outflow. Okay, activation of alpha 2 receptors in the CNS region means what will happen? The sympathetic outflow, it will be decreases. Okay, and reduction of BP is occurs and bradycardia is occurs. So the best example for the alpha 2 agonist is clonidine. So this clonidine drug, it is used for the treatment of hypertension. Because of this, clonidine drug is decreases the sympathetic outflow. So how it is decreases the sympathetic outflow? So what is the mechanism of action of clonidine? Okay, so this clonidine is used for the treatment of high blood pressure. Okay, because of why it is used for the treatment of hypertension? Because of this drug is stimulate the alpha 2 receptors in the brain region. Okay, then what will happen? In brain region, alpha 2 receptors, it will be activated, then which decreases the peripheral resistance. As a result of stimulation of this alpha 2 receptors, there is a decrease in the peripheral vascular resistance. And one more reason is as a result of decrease in the peripheral vascular resistance, there is a BP is also reduced. Okay, so what is peripheral vascular resistance means what? The resistance of the arteries to the blood flow is called as peripheral resistance. Okay, the peripheral vascular resistance is decreases means what? The vasodilation effect, it will be produced. Okay, and one more thing is one more reason, the peripheral vascular resistance is decreases. It is one reason. And one more reason, the presynaptic alpha 2 receptors in vasomotor centers is by the binding, it will be increases. Okay, so the adrenergic drugs are see here, the alpha 2 receptors are is present in both region, that is alpha 1 alpha 1 receptor is present in postsynaptic region and presynaptic region. In both regions, the alpha 2 receptors is present. Okay, so here the alpha 2 agonist drug is binds with presynaptic alpha 2 receptors. Okay, presynaptic alpha 2 receptor. See this, this one is presynaptic nerve terminal. Okay, and this one is postsynaptic nerve terminal. Okay, so here this alpha 2 receptors is present in which region? Both presynaptic region and postsynaptic region. Okay, so in case here the clonidine drug, it is alpha 2 agonist. So this clonidine drug is decreases the sympathetic outflow. And it is used for the treatment of blood pressure. Because of this, clonidine drug is decreases the peripheral vascular resistance. And one more reason is the clonidine drug is binds with this alpha 2 receptors. See this, this one is alpha 2 receptors. So this alpha 2 receptor is present in presynaptic nerve terminal and postsynaptic nerve terminal. Okay, here clonidine, it is binds with alpha 2 receptors in presynaptic alpha 2 receptors. Okay, especially at the brain stem region. Okay, especially in the vasomotor center in the brain stem. Okay, so as a result of this binding, okay, the see this one, C means here the clonidine drug, it is binds with alpha 2 receptors. So as a result of this binding, there is a decrease in the presynaptic calcium levels. Decrease in the what? decrease in the presynaptic calcium levels. Then what will happen? There is an inhibiting the release of norepinephrine from the synaptic vesicles. See this. This is a presynaptic nerve terminal consists of synaptic vesicles. So here clonidine after binding with alpha 2 receptors, in what will happen as a result of this binding, the levels of calcium in the presynaptic nerve terminals is decreases. Then there is a inhibiting the release of norepinephrine from that nerve terminals. Okay, so norepinephrine release, it will be decreases. Norepinephrine. So norepinephrine levels, it will be decreases. So norepinephrine levels is means decrease in the release of norepinephrine from the presynaptic nerve terminals. Then what will happen? The net effect is a decrease in the sympathetic tone. Okay, means what? The sympathetic transmission, it will be decreases because of decrease in the release of noradrenaline neurotransmitter from that presynaptic nerve terminals. Okay, so total this processes happens at the vasomotor center region, especially at the brain stem. Okay, and that's why this drug is used for the treatment of hypertension. Actually, this one is alpha 2 agonist drug. Clonidine, it is alpha 2 agonist drug. Clonidine, it is a alpha 2 agonist drug, but this drug is wait a moment. I will erase this content. Okay. Now it will be free. So the chlorine drug, it is an alpha 2 agonist. Okay, so as a result of activation of alpha 2 receptors, then what will happen? The sympathetic outflow, it will be decreases. Then reduction in the BP, and it causes the bradycardia. Okay, clonidine, it is an alpha 2 agonist drug. Okay, this is used for the treatment of blood pressure because of it decrease in the release of norepinephrine from the nerve terminals. Because of this chlorine drug, it is binds with the presynaptic alpha 2 receptors. Then what will happen? This, as a result of this binding, there's a decrease in the presynaptic calcium levels. Then there is inhibit the release of norepinephrine. So the overall, the net effect is decreases the sympathetic tone. Okay, and next one is metabolic effects. What is that metabolic effects? So metabolic effects, what increases the concentration of glucose and lactic acid, means hyperglycemia is occurs. Why? Because of it is stimulate the glycosenolysis. So what do you mean by glycosenolysis? Glycosenolysis means what? The breakdown of glucose molecules into a glycogen, that is called as glycosenolysis. So the glycosenolysis is occurs due to beta effect. Okay, so as a result of glycosenolysis, the glucose levels in the blood region is increases, that is called as hyperglycemia. And one more reason is it decreases the uptake of glucose by peripheral tissue. So that the uptake of glucose by peripheral tissue is decreases means what? The concentration of availability of glucose in the blood region is also increases, that is called as hyperglycemia. And it is inhibit the release of what? Insulin, due to stimulation of alpha 2 receptors. So due to stimulation of alpha 2 receptors, there is a cyclic AMP formation is increases, and there is a inhibit the release of insulin. So it inhibit the secretion of insulin means what? There is a availability of glucose in the bloodstream is increases, and it is increases the free fatty acid concentration in the blood region. Due to this drug is causes the lipolysis process. Okay, and it is causes the calorogenesis due to B2 receptor activation and beta 3 receptor activation. So as a result of this activation, there is a generation of heat. So the generation of heat is occurs by the digestion of the food. Okay, so that sclerogenesis is also occurs due to activation of beta 2 and beta 3 receptor activation. Then hypokalemia is occurs. So first initially hyperkalemia is occurs. So why hyperkalemia is occurs? Because of initially what the liver. Okay, so the liver, it is initially releases the potassium ions. Okay, that's why the within the blood region the potassium ions are levels is increases. That is called as hyperkalemia. Okay, then afterwards the hyperkalemia is initially hyperkalemia is occurs, then hypokalemia is also occurs. So this hypokalemia is occurs due to enhance the uptake into the skeletal muscles as well as liver. Okay, enhance the uptake of what ions? Potassium ions into the skeletal muscles and into the liver. Okay, first the transient hyperkalemia is occurs and it is followed by hypokalemia. Hyperkalemia is occurs due to initial release of potassium from the liver, and hypokalemia is occurs due to enhance the uptake of not calcium, potassium. Sorry, hyperkalemia means increase in the levels of potassium. So hyperkalemia is occurs due to initial release of potassium from the liver, and hypokalemia is occurs due to enhance the uptake of potassium from the potassium into the what? Skeletal muscles and liver. Okay, so these are the metabolic effects of adrenergic drugs. Next one. And what is the effect on eye? Okay, one more thing, note down. What is the effect on eye? This adrenergic drugs effect on eye is mydriasis effect. Okay, due to contraction of radial muscles of iris because of activation of alpha-1 receptors. Due to activation of alpha-1 receptors, there is a contraction of radial muscles of iris. And finally, the intraocular tension is also reduced, especially in the wide angle glaucoma. Okay, and what is the overall effects of adrenergic receptors? Okay, the overall adrenergic drug receptor activity. Okay, so here the characteristic subtypes of adrenergic receptors. Receptors alpha-1, agonist is phenylephrine, antagonistic is prazosin. Okay, this alpha-1 receptors especially is present on what? Vascular smooth muscles. So it shows the contraction effect. Okay, due to it is coupled with what kind of receptors? GS coupled, GQ coupled receptors. Alpha-1 is GQ coupled receptor, and the effect on liver is glycosinolysis and gluconeogenesis. Okay, finally the blood glucose concentration is increases, and the intestinal smooth muscle is hyperpolarization is occurs, and finally the relaxant effect it will be produced, and heart is what? Contraction effect it will be occurs. Okay, the contraction and centripetal force and arrhythmias is also occurs. Effect on alpha-2 receptor agonist is clonidine, antagonistic is yohimbine, and effect on pancreatic isolates is what? Decrease in the insulin secretion. Then what will happen? The blood glucose concentration is increases. Effect on platelets is aggregation. Effect on vascular smooth muscles is contraction. Both alpha-1 and alpha-2 effect on vascular smooth muscle is contraction effect. Okay, and next beta-1. Beta-1 agonist is dobutamine, antagonist is metoprolol, and beta-1 location is juxtaglomerular cells. Okay, what is the response is increase in the release of renin, and beta-1 is present in nerve terminals, and effect is decrease in the release of noradrenaline. And beta-1 mainly it is present on heart region, so that's why the heart rate is increases, force of contraction is increases, positive inotropic, conotropic is occurs, and conduction velocity is increases at the AV node. And beta-2 Agonist is salbutamol and terbutaline. Antagonistic is alpha-methyl-propanolol. And beta 2 is mainly located at the smooth muscles, skeletal muscles, and liver. So in case of smooth muscle, relaxant effect is occurs. Skeletal muscles means glycosinolysis. Liver means glycosinolysis and gluconeogenesis. And beta 3, it is a new subtype of beta receptors, and is mainly located at the adipose tissue, and the response is lipolysis. Okay. So this one is information about the pharmacological actions of what adrenergic drugs. Okay. And in next class, we will discuss about what is the adverse effects, contraindication, and what is the uses, and some individual drugs, specific actions, and nasal decongestant. I will discuss about nasal decongestants also. Okay. Thank you.